Stroke, Health Guide. A stroke, a debilitating brain injury, results from the interruption of the brain's blood supply. This interruption can be attributed to various causes, leading to the classification of strokes into three primary categories: hemorrhagic stroke, thrombotic stroke, and embolic stroke. Hemorrhagic stroke. Hemorrhagic strokes constitute a critical subtype of strokes, characterized by bleeding within the brain, intracerebral hemorrhage, or between the brain and the skull, subarachnoid hemorrhage. While less common than strokes caused by blood clots, hemorrhagic strokes pose severe risks and often result in significant neurological consequences. Causes. The primary cause of hemorrhagic strokes is bleeding that leads to the accumulation of blood in or around the brain. This bleeding can be attributed to several factors. Hypertension, high blood pressure. Elevated blood pressure is a major risk factor for intracerebral hemorrhage. Prolonged hypertension can weaken small blood vessels in the brain, making them susceptible to rupture. Cerebral amyloid angiopathy. This condition involves the deposition of amyloid proteins in the walls of blood vessels, increasing the likelihood of vessel rupture and hemorrhage. Aneurysms and arteriovenous malformations, AVMs, weakened areas in blood vessel walls, known as aneurysms, and abnormal connections between arteries and veins, AVMs, can rupture, causing hemorrhagic strokes. Age and gender. Hemorrhagic strokes are more prevalent in older individuals, and some studies suggest a higher incidence in males. Substance abuse. The use of certain substances, such as cocaine or methamphetamines, can contribute to elevated blood pressure and increase the risk of hemorrhagic strokes. Symptoms. The symptoms of a hemorrhagic stroke can manifest suddenly and may include severe headache, often described as the worst headache of one's life. This sudden and intense headache is a common symptom. Neurological deficits, weakness or paralysis on one side of the body, difficulty speaking, and visual disturbances are common signs. Vomiting, headache and increased intracranial pressure can lead to nausea and vomiting. Altered consciousness, ranging from confusion and stupor to coma, depending on the severity of the bleeding. Prompt recognition of these symptoms is crucial, as early intervention can significantly impact the outcome. Diagnosis. Diagnosing hemorrhagic strokes involves a combination of medical history reviews, physical examinations, and imaging tests. Common diagnostic tools include computed tomography, CT, scan, provides detailed images of the brain, enabling rapid identification of bleeding. Magnetic resonance imaging, MRI, offers a more detailed view of the brain, helping in the characterization of the hemorrhage and identification of underlying causes. Cerebral angiography, invasive imaging to visualize blood vessels and identify abnormalities such as aneurysms or AVMs. Lumbar puncture, assessing cerebrospinal fluid for the presence of blood, aiding in the diagnosis of subarachnoid hemorrhage. Treatment. Hemorrhagic strokes necessitate immediate and specialized medical attention. Treatment strategies aim to control bleeding. In cases of aneurysmal rupture or AVM bleeding, surgical interventions may be required to repair the damaged blood vessels. Manage intracranial pressure, measures to alleviate pressure on the brain, such as draining excess fluid or removing blood clots, may be employed. Address underlying causes, identifying and addressing the root cause, such as hypertension or cerebral amyloid angiopathy, is vital to prevent recurrent hemorrhages. Supportive care, monitoring and managing complications, including neurological deficits and respiratory issues, are essential components of supportive care. Prevention of hemorrhagic stroke. Control hypertension. High blood pressure. Hypertension is a major risk factor for hemorrhagic strokes. Regular monitoring of blood pressure and adherence to prescribed medications can help manage and control high blood pressure. Healthy lifestyle choices. Adopting a healthy lifestyle can significantly reduce the risk of hemorrhagic strokes. This includes maintaining a balanced diet, engaging in regular physical activity, and avoiding excessive alcohol consumption and illicit drug use. Regular exercise. Physical activity helps regulate blood pressure, control weight, and improve overall cardiovascular health. Aim for at least 150 minutes of moderate intensity exercise per week. Limit alcohol consumption. Excessive alcohol intake can contribute to high blood pressure and increase the risk of hemorrhagic strokes. Limit alcohol consumption to moderate levels or as advised by healthcare professionals. Avoid illicit drug use. Substances like cocaine and methamphetamines can elevate blood pressure and increase the likelihood of hemorrhagic strokes. Avoiding these substances is crucial for stroke prevention. Manage underlying conditions. Conditions such as diabetes and certain blood disorders can contribute to an increased risk of hemorrhagic strokes. Proper management and control of these underlying conditions are essential. Prognosis. The prognosis for individuals with hemorrhagic strokes varies based on factors such as the location and extent of bleeding, the effectiveness of treatment, and the presence of underlying health conditions. Recovery can be a lengthy process, often involving rehabilitation to regain lost functions. Thrombotic stroke. Thrombotic strokes, a common subtype of strokes, occur when a blood clot, thrombus, forms inside one of the brain's arteries, obstructing blood flow. These strokes often result from atherosclerosis, a condition characterized by the buildup of fatty deposits along blood vessel walls. Understanding the causes, symptoms, diagnosis, and treatment of thrombotic strokes is crucial for effective management and prevention. Causes. The primary cause of thrombotic strokes is the formation of blood clots within cerebral arteries. Key factors contributing to clot formation include atherosclerosis, progressive narrowing and hardening of arteries due to the accumulation of cholesterol and other substances along blood vessel walls create an environment conducive to clot formation. Arterial dissection. A tear in the artery wall can lead to the formation of a blood clot, impeding blood flow to the brain. Hypercoagulable conditions, disorders that increase blood clotting, such as certain genetic conditions or autoimmune disorders, can elevate the risk of thrombotic strokes. Atrial fibrillation. Irregular heart rhythms can lead to blood pooling in the heart, increasing the likelihood of clot formation and subsequent stroke. Symptoms. Thrombotic stroke symptoms vary depending on the affected area of the brain, but common signs include sudden onset of weakness or paralysis, typically on one side of the body. Speech difficulties or slurred speech, impaired ability to speak or articulate words. Visual disturbances, sudden loss of vision or other visual abnormalities. Coordination and balance issues, difficulty walking or maintaining balance. Severe headache, particularly if accompanied by other neurological symptoms. Prompt recognition of these symptoms is crucial, as early intervention can minimize damage and improve outcomes. Diagnosis. Diagnosing a thrombotic stroke involves a comprehensive assessment, including medical history review, identifying risk factors such as hypertension, diabetes, or previous strokes. Physical examination, assessing neurological function to detect signs of stroke. Imaging tests. Computed tomography, CT, scan, reveals the presence of bleeding and helps rule out hemorrhagic stroke. Magnetic resonance imaging, MRI, provides detailed images for a more accurate diagnosis. Magnetic resonance angiography, MRA, or CT angiography, CTA, visualizes blood vessels to identify clots or narrowing. Electrocardiogram, ECG or EKG, detects irregular heart rhythms, which may contribute to clot formation. Treatment. Immediate treatment of thrombotic strokes aims to restore blood flow and prevent further damage. Strategies include clot-dissolving medication, TPA, administered within a critical time window to break down clots and restore blood flow. Early intervention is crucial for its effectiveness. Antiplatelet medications, drugs like aspirin may be prescribed to inhibit platelet aggregation and reduce the risk of further clot formation. Anticoagulants, medications such as warfarin or direct oral anticoagulants, DOACs, may be recommended to prevent the formation of new clots. Blood pressure management, controlling hypertension is essential to reduce the risk of recurrent strokes. Prevention of thrombotic stroke. Control high blood pressure. Hypertension is a common risk factor for thrombotic strokes as well. Regular monitoring and management of blood pressure are crucial in preventing blood clot formation. Antiplatelet medications. In individuals at risk of thrombotic strokes, doctors may prescribe antiplatelet medications, such as aspirin, to prevent the formation of blood clots. Anticoagulant medications, for individuals with conditions like atrial fibrillation, where blood clot formation is common. Anticoagulant medications like warfarin or direct oral anticoagulants, DOACs, may be prescribed to prevent clots. Healthy diet. Adopting a heart-healthy diet that is low in saturated fats, trans fats, and cholesterol can help prevent the buildup of plaque in arteries, reducing the risk of thrombotic strokes. Regular exercise. Physical activity promotes healthy blood circulation, reducing the risk of blood clots. Engage in regular exercise as recommended by healthcare professionals. Control diabetes. Proper management of diabetes is essential in preventing thrombotic strokes. Monitoring blood sugar levels and adhering to a diabetes management plan are crucial components. Quit smoking. Smoking contributes to atherosclerosis and increases the risk of blood clot formation. Quitting smoking is a key step in preventing thrombotic strokes. Address atrial fibrillation. For individuals with atrial fibrillation, proper management of this condition, including medications and lifestyle modifications, is essential to reduce the risk of blood clot formation. Rehabilitation and follow-up. Following the acute phase of treatment, rehabilitation plays a vital role in helping individuals recover lost functions. Physical therapy, occupational therapy, and speech therapy may be employed to address specific deficits and enhance overall recovery. Ongoing medical management, including addressing underlying risk factors, is crucial for preventing recurrent thrombotic strokes. Embolic stroke. Embolic strokes occur when a blood clot or debris mass, known as an embolus, travels to the brain and obstructs a blood vessel. These strokes are often associated with conditions like atrial fibrillation, where irregular heart rhythms can contribute to the formation of emboli. Understanding the causes, symptoms, diagnosis, and treatment of embolic strokes is crucial for effective management and prevention. Causes. The primary cause of embolic strokes is the migration of emboli, typically blood clots, from other parts of the body to the brain. Key contributing factors include atrial fibrillation. Irregular heart rhythms can lead to the formation of blood clots in the heart, which may then travel to the brain. Heart valve disorders. Abnormalities in heart valves, particularly if associated with bacterial infections, can lead to the formation of emboli. Deep vein thrombosis, DVT, blood clots originating in the deep veins, often in the legs, can dislodge and travel to the brain. Endocarditis, inflammation of the heart lining can result in the formation of clumps of bacteria and inflammatory cells that can act as emboli. Symptoms. Embolic stroke symptoms are similar to those of other types of strokes and may include sudden onset of weakness or paralysis, typically on one side of the body. Speech difficulties or slurred speech, impaired ability to speak or articulate words. Visual disturbances, sudden loss of vision or other visual abnormalities. Coordination and balance issues, difficulty walking or maintaining balance. Severe headache, particularly if accompanied by other neurological symptoms. Prompt recognition of these symptoms is crucial, as early intervention can minimize damage and improve outcomes. Diagnosis. Diagnosing an embolic stroke involves a comprehensive assessment, including medical history review, identifying risk factors such as atrial fibrillation, heart valve disorders, or previous embolic events. Physical examination, assessing neurological function to detect signs of stroke. Imaging tests. Computed tomography, CT, scan, helps rule out hemorrhagic stroke and provides initial information. Magnetic resonance imaging, MRI, offers detailed images for a more accurate diagnosis. Magnetic resonance angiography, MRA, or CT angiography, CTA, visualizes blood vessels to identify emboli or narrowing. Electrocardiogram, ECG or EKG, detects irregular heart rhythms, a common contributor to embolic strokes. Treatment. Immediate treatment of embolic strokes aims to restore blood flow and prevent further damage. Strategies include clot-dissolving medication, TPA, administered within a critical time window to break down clots and restore blood flow. Early intervention is crucial for its effectiveness. Antiplatelet medications, drugs like aspirin may be prescribed to inhibit platelet aggregation and reduce the risk of further clot formation. Anticoagulants, medications such as warfarin or direct oral anticoagulants, DOACs, may be recommended to prevent the formation of new emboli. Management of underlying conditions, treating conditions such as atrial fibrillation or heart valve disorders is essential to reduce the risk of recurrent embolic strokes. Prevention of embolic stroke. Anticoagulant medications, individuals with conditions predisposing them to embolic strokes, such as atrial fibrillation or artificial heart valves, may be prescribed anticoagulant medications. These medications, like warfarin or direct oral anticoagulants, DOACs, help prevent the formation of blood clots. Antiplatelet medications, some individuals at risk of embolic strokes, especially those with certain heart conditions, may benefit from antiplatelet medications such as aspirin. These medications inhibit platelet aggregation, reducing the risk of blood clot formation. Management of atrial fibrillation. Proper management of atrial fibrillation is crucial in preventing embolic strokes. This may include medications to control heart rhythm and rate, as well as anticoagulant therapy. Treatment of deep vein thrombosis, DVT, individuals with a history of deep vein thrombosis, a condition where blood clots form in deep veins, may be at an increased risk of embolic strokes. Treating and preventing DVT through medications and lifestyle measures can reduce this risk. Heart valve surgery, in cases where heart valve disorders contribute to embolic stroke risk. Surgical interventions to repair or replace faulty valves may be recommended. Lifestyle modifications, adopting a heart-healthy lifestyle can contribute to overall cardiovascular health and reduce the risk of embolic strokes. This includes maintaining a balanced diet, engaging in regular exercise, and avoiding smoking and excessive alcohol consumption. Control diabetes. Proper management of diabetes is essential in preventing embolic strokes. Monitoring blood sugar levels and adhering to a diabetes management plan can contribute to overall vascular health. Quit smoking. Smoking is a significant risk factor for cardiovascular diseases, including embolic strokes. Quitting smoking is crucial for reducing this risk. Addressing hypercoagulable conditions. Individuals with conditions that increase blood clotting, known as hypercoagulable conditions, should work closely with healthcare professionals to manage and monitor their condition effectively. Maintain a healthy weight. Obesity is a risk factor for various cardiovascular conditions. Maintaining a healthy weight through a combination of regular exercise and a balanced diet can contribute to stroke prevention. Rehabilitation and follow-up. Following the acute phase of treatment, rehabilitation plays a vital role in helping individuals recover lost functions. Physical therapy, occupational therapy, and speech therapy may be employed to address specific deficits and enhance overall recovery. Ongoing medical management, including addressing underlying risk factors, is crucial for preventing recurrent embolic strokes. Your health matters. Quali.Health